Thanks for training with me today and joining this army of chiropractors around the world doing so. This is True North, and of course our purpose is singular, to help you increase your new patient attraction, to see your retention and rewards, your revenue growing, and to help you influence your community with chiropractic. And we do that by answering real questions that are affecting chiropractors all over the world. Today we have a question in from Dr. Cindy, and she says, I want to use nutrition in my practice, but it really seems to be negatively affecting my practice. What have you seen work to combine the two successfully? Thanks for your advice. This is huge. I want you to know that more and more chiropractors are wanting to bring nutrition into their practice, but let me tell you exactly what I've witnessed in over 5,000 practices just in the last 5 to 6 years. That the amount of revenue and success that the practice grows as a result of the nutrition is exactly how much the practice drops in terms of the chiropractic care it delivers. In other words, it's a net zero. That is not healthy for your practice. At the end of the day, it's not healthy for your patients because they'll be choosing nutrition or chiropractic when it should be nutrition and chiropractic, and you need to understand that. It would be better not to put nutrition in at all if that was going to be the case. So I always want to leave you with 3 strong suggestions about what can you do right now if you already have nutrition or you've been thinking about nutrition in your practice. The first is the concept of allopathic nutrition versus every person every day, which comes from my good friend, Dr. James Chestnut. The allopathic approach to supplemental nutrition would be diagnosing somebody first, seeing what kind of illness they have, and then giving something for that. Well, that's exactly what the medical profession does with their medication. So we do not want to be in a situation where we're trying to actually function from above down and be holistic with our adjusting skills and the way we teach our patient in that way, and then supplement the way the medical doctors farm out medicine. It doesn't fit, and in fact, it never has, and that's what causes a huge break or gap inside a chiropractic practice. Every person, every day, we're talking about the big 3. We're talking about the reason why somebody would want to have omega-3, the reason why somebody would want to take probiotic, the reason why somebody would want to have vitamin D, for example, is that these are things that every person needs in their nutrition every day. And so it's not allopathic as much as it is the physiological essentials of the body. We also know that as we give these materials to the body and the power is now opened by the adjustments, the power in the body is able to use these essentials in a way to heal and repair every cell in the body. In that way, the supplements follow your philosophical message as opposed to bombard it. You'll find that people will actually follow this brilliantly if you see the new higher path. The second thing is to make it all about the nerve system. You know, it sounds like I might have said that in the first one, so that must be pretty big, right? The power is everything. The flow through the nerve system is the only way healing has ever happened. The reason why these supplements are so important is to make sure your nerve system is firing at 100%. Do you notice what just happened there? It wasn't about the supplements for the body. It was about the supplements for the nerve system, because the nerve system is the master healing system of the body. Make sure the supplements are supporting the philosophy of chiropractic. And once again, the supplements or nutrition will be helping your patient more than you could imagine. And finally today is to think about when you integrate these 3 and maybe 4, and you think about, for example, an organic multivitamin, these are all things that you can find at innatechoice.com, and I would highly recommend that you take a very good look at what Dr. Chestnut has provided the chiropractic profession worldwide, the finest line of these supplements, and I believe the finest message on how these things integrate with the philosophy of chiropractic. But nonetheless, my suggestion is make sure it's in the care plan. In other words, don't have separate fees for supplement and separate fees for chiropractic. Put them together so there's one plan, and they march out that plan and they invest in that plan, and it's not a la carte. If you put nutrition a la carte, it'll appear to be an add-on. It'll appear to be separate. It'll appear to be an alternative rather than absolutely in alignment with everything that you're doing. You clean this up and you're going to see not only your practice growing and your nutrition growing inside the practice, your patients are going to be healthier and happier than ever. Until next time, and as always, practice with passion. Have a wonderful day. God bless.